My name is Patrick O'Sullivan. I'm a third year osteopathic medical student at Comp Northwest. I'm still currently exploring my interests across like multiple specialties, so I don't really know what I've chosen yet. But this is all about osteopathic medicine and why I ultimately chose it over becoming an allopathic physician like my MD counterparts. Really, what drove me to become an osteopathic physician is just the philosophy behind it. The idea that that patients are a whole person and they have interconnected physical, emotional, as well as structural influences on their health. So when someone asks me why did I choose osteopathic medicine or why osteopathic medicine, I think the best answer for me is that we are similar to our allopathic brethren in that we are fully trained medical doctors. We have an expanded lens. We learn everything that's expected of physicians, such as diagnosis, evidence based treatment, pharmacology, procedural medicine. But we're also trained to see how structure and function and environment and lifestyle will all shape a patient's story in ways that don't always show up on a lab result or a scan. So, for me, an osteopathic principle that helps anchor my approach every day on my rotations is that even when I'm not using my hands for specific OMT principles, the way I take a history or how I pay attention to someone's biomechanics during a physical exam, or how I may think through like pain patterns and consider barriers to healing, whether that's like structural or psychosocial or environmental. I've noticed that it like leads me to a stronger rapport with my patients, having like a better grasp of their lived experience and often a clearer understanding of why a condition is happening in the first place. So for me, being an osteopathic physician isn't just about having additional tools like having OMT, for instance, but it means valuing that patient's ability to heal and supporting that process with everything from lifestyle conversions or conversations, sorry, to manual medicine when appropriate, and integrating all of that with modern medical management. So it's about being someone who listens deeply and treats someone as a comprehensive picture. So I really want to see how these principles that I've learned over the last few years will guide me through practice and get me into through residency. And yeah, I'm very excited to, outside of just using osteopathic techniques within my practice, using some of that holistic experience and that I've learned and garnered and practiced to help really treat and benefit my patients for the rest of my career. So to me, that's what being an osteopathic physician is, and that's why I chose to become an osteopath.